Okay. Go ahead.
Today is Blue Friday.
And what else is it?
And it's Egg Retrieval Day.
What is it?
It's Egg Retrieval Day.
Yeah, high five. Yeah. This is all you're going to be wearing. You look very beautiful. You ready to get those eggs sucked out of you?
No. I need to wear my socks. Here's my socks.
So you get free socks out of this.
Yeah. How do I wear this thing?
It's got to go to the grip part of the bottom.
Okay, so it's Egg Retrieval Day. We've been here since 7 in the morning.
Yeah, it's like you've been here for like 30 minutes.
Yeah, and I'm super nervous. But I had surgery before, so I hope
But
it's
not on your eggs, though.
No, but it should be the same thing. They will knock me out, and I wouldn't feel a thing. So, just getting ready.
Nice to meet you.
Oh, hi.
Nice
Sorry,
to meet
sorry.
you.
Hi,
Okay, so what we're going to do is talk about the egg retrieval today. I'm going to be doing your egg retrieval. I'm going to just kind of outline the process, but feel free to interrupt me if you have any questions.
Okay.
So what we're going to do is we're going to bring you to the back. You're going to go to sleep. You're going to get some anesthesia through the IV.
Okay.
Once you're asleep, we're going to put your legs up in leg rest, and then we do a transvaginal ultrasound, the same that you've had in clinic.
Okay.
Except this ultrasound has a little needle guide along the side, and a needle will go through the top of the vagina into both of the ovaries.
Is it a sharp needle?
It's a normal needle.
Okay. I'm not gonna get poked.
It's internal. You won't know, but it is normal to have a little bit of like bleeding after the egg retrieval.
Okay.
So we'll go into the follicles that we've been measuring ultrasound and drain the fluid from those follicles, and inside the fluid is the egg.
Okay.
And then all the fluid will go off to the embryology lab, and then basically under the microscope they'll pick out the microscopic eggs.
Okay.
And then we will wake you up, bring you back to the recovery room. You usually spend around 45 minutes here recovering. You will wake up feeling kind of crampy, so we'll give you some pain medication to kind of help with that. And then you will also get a prescription for pain medication to go home with to kind of take as you need today.
Okay.
Some people need to take it a lot, some people don't. It just kind of depends on your pain tolerance, probably more than anything else.
Okay.
We'll tell you the number of eggs that we get today. We won't know how many of those eggs are good or how many of them are mature or anything like that. We can tell you the total number. And it is normal that you should expect some attrition. So tomorrow we will tell you, okay, of the eggs we got, this many were mature, this many got, ICSI'd, and this many actually successfully fertilized, etc. Tomorrow, you should be feeling okay. Like most patients feel like they can get up and do their normal thing. Like you won't feel totally normal. You'll still feel like bloated and sore, but you should be able to do all your normal activities. But I wouldn't push yourself if you're not feeling like 100%. You can definitely be walking around. I don't know if like you'd be running.
Okay. Okay. Okay, maybe I'll just.
Yeah, take a day off, Iron Man.
It is Saturday.
I know, right?
Okay.
Risks of any surgical procedure are going to be bleeding, infection, damage to internal organs, blood vessels, nerves. We always have to mention that, although realistically speaking, the risks of this procedure are low, less than 1%.
Okay.
What questions do you have?
So 1 egg per follicle? Is that what it's going to be?
Yes, although only the larger follicles have a mature egg, and the really, really small follicles, lots of times we can't even get the egg from them.
Yeah, I don't think I'm going to have more than 10.
Well, they said that they'll do the shot if they have to.
Oh yeah, my ecg shot? Are you going to do that after?
We'll do that depending on how many we get. So if we don't get a ton, then we'll go ahead and give it to you so we can set up to do a fresh transfer.
Well, I'm out, right? Yeah. Okay.
She's just worried because, like, the circumstances that we have, we're just like...
You want everything in your favor as much as possible.
Yeah.
I mean, the rest of it has to go with like what's on me, So like, so the combination of the two, we're like, okay. So.
Yeah. Okay. Yeah.
But I don't think you're in a bad position. Like I don't really get super stressed out unless my patient's like 43 and has 2 eggs. Then I'm super stressed out.
Okay.
No, we're just a little bit stressed because it's like low sperm count and then like low egg count. So the combination of the two is like, oh yeah, that's an awesome combo.
My ultrasound didn't look like I have a lot of eggs, which can be a good thing though. Like, it should be like quality, right?
You know, there's 2 separate things, quality and number, and their relationship is super confusing. They're not always, they don't have a clear relationship in terms of like even going along together.
Okay. We'll just
age is the biggest predictive factor of success in terms of,
I'm 35, so
that's good.
It's good. Okay. Yeah. It's still good.
I'm going to take a quick listen to your heart and lungs.
Okay.
Dr. Nichols, our anesthesiologist, is going to come chat with you, and then we'll bring you back to do the retrieval.
Cool.
Any questions for me?
Non-expanding.
Yeah, it's going to do that.
I'm
just going to put this on. Right behind it.
So they give you the shot though. So
Yay!
they got the most eggs out of you as possible. So, you know. But you feel okay? You don't seem nearly as delirious as I was hoping you were going to be. One more cracker, you good?
I just want, can I get one more apple juice?
Sure, let me grab
I told you, I knew she likes apple juice.
Yeah.
You still want some mushroom soup later? Or you just want to go lay back down? Yeah.
How's your sperm? Did you collect more?
Shit, no. It was like maybe like 2 spoonfuls. Well, that's it. Not much, but hopefully one of those is a good swimmer.
That's good.
Yeah. I should have taken some of that Chinese herbal stuff.
Yeah. But it took a lot, so.
Yeah. Sorry, we're just talking about my specimen cup.
Oh.
I'm good. I'm
Okay.
good.
Everything went really smoothly.
Oh, good.
Yeah, so
good.
we'll find out tomorrow how many of the eggs were mature.
Do you think they're good quality?
Yeah, everything looked fine. I mean, I don't look at the eggs under the microscope, the embryologist does.
Oh, okay.
But the follicle sizes all looked good. I mean, I don't think that all of them are going to be mature, and that's normal, you know, because we go into all the smaller follicles too, because sometimes they have a mature egg, sometimes they don't. So we
totally understand.
Yeah.
So, but how many eggs?
15.
Oh, good.
Yeah.
So maybe half of it.
Yeah,
And
I think that's reasonable.
Of the 15
Expect.
eggs, does it matter what size they are?
No, it depends on the nuclear maturity, which they will assess by looking at under the microscope.
And we'll know that tomorrow.
We'll know that tomorrow.
All right. So we'll do an update tomorrow.
Cool. Thank you so much, doctor.
course.
Appreciate it.
It was great
Thank you
to
so
meet
much.
Thank you so much.
It was great to
Thank
meet you as well.
Thank